things on our agenda for today. We can go ahead and begin with our presentation from CWI. If you guys would like to get started.
Okay, I'm gonna drive and you drive.
Okay,
And
I'll
I'll
do
drive
that.
for you.
All right,
Sounds good.
thank you.
It's okay?
Yes.
I can speak very loudly. Oh, so where am I talking? Sure. No, I can do this here.
Here, take
This is fine. I'm good.
sure?
Yeah. I got shot. I didn't realize that we're streaming for others, so
Okay, so
now I
yes.
understand.
Thank you.
Yes, so thank you for giving us the opportunity to come in and speak with you about the local workforce collaborative that we are hoping to realize in the next year in the city of East Chicago. We came previously in the spring to share the concept with you, which was very well received. And we're excited to come in. We've got a little bit of a refresher for you just to bring us all together. And I know that we're eager to talk about next steps, which will require some approval from you today in regard to a memorandum of understanding so that we can take next steps. So, Shelley, thank you. You know, you may recall that NWI Works, it is officially a 501c3 now that is intended to represent all of the different partners that would be participating in the local hubs. This slide that you see here, you may recall, really kind of brings together visually what we intend to bring together in the physical space within Karigosh. These organizations represent what a local team from your community leaders across sectors identified as needs for, or you know, needs may be a strong word, but resources that your community, the surrounding community would be interested in. I'm coming from a workforce development perspective, and what I know is that I can't do workforce development alone. My organization, you know, brings in a lot of resource to the community, but we're not embedded in the community like some of the local partners are. And so for us to bring workforce development to scale, which is ideal because there is a lot of opportunity, but folks either don't know where those resources are and what the opportunity for career pathways may be, they can't access it. So bringing workforce development as an anchor into a local neighborhood hub is ideal. These other partners that would be located, we haven't figured out specifically who all those players are, but your local community team identified who they might be. And we certainly see the different types of providers that would be available, which would allow individuals to not just access training and jobs, but other resources that will help them overcome any of those common barriers that we know so many people have, like transportation, childcare are probably the top two. You know, what you've got to think about workforce development as a continuum. that has many different types of, skill building and training involved. Early childcare, which you have up there through, it's my opinion that's backed up by lots of research and data that workforce development begins when kids are probably about 3 years old, and they're learning to have eye contact, they're learning to share, they're learning to socialize, operate together, through that continuum of higher ed. And of course, our organization and our partners, the work that we do lands squarely with job and trade skill training, and connecting youth, particularly out of school youth, and adults who are interested in connecting to skill development and all of the opportunities. In Northwest Indiana last year, there were 94,000 jobs posted. And we know that there is a plethora of opportunity. Folks just need to know what the on-ramps are to get into these pathways and what the skill building lattice, so to speak, looks like, so that they ultimately can obtain family sustainable wage jobs. And we're excited to bring that to East Chicago. We've got, Shelley, is this kind of where you want to talk about the scope of the project?
Yep. Yep.
Answer the curious questions that you may have?
Yeah, so we were asked to kind of give an update since last time we got into the, I don't know if this has to be close or we talk loud. Since last time, we really got into how we came to the conclusion of doing the census tract analysis that help us identify the best centralization of where the most distressed communities are that need many of the services that Lisa has talked about. So we aren't going to go through all of that all over again, but in terms of an update, this represents really the steps that are the big steps of the process. So engaging local leadership, which we've done, identifying the community needs and gaps, which we've done, and identifying a hub location, which through that process, the former Carrie Gosh site was identified. The green check identifies where we want to begin now. That would be the design and development plan. That's taking the space, which I'll go through some of the slides we went through last time, where we started to identify the different areas of the building and what types of uses we might recommend based upon the walkthrough that we've done and what we've learned about the site from the prior floor plans and so forth that we received. Much of that design occurs by working specifically with service providers. So we have not to this point started the engagement of working with a wide array of service providers for East Chicago specifically. We have been talking with HealthLink, as a matter of fact. Nathan's sitting here. We know each other very well in terms of Michigan City. We've talked about East Chicago as well in terms of the types of services. Other regional providers with food banks, you've got CoAction, obviously CWI, United Way. Many of those players know what we're doing here in East Chicago and are ready to start specifically those programming discussions around the Carrie Gosh site and how we're seeing some of those uses occur. We've been waiting to engage in that basically because of the MOU. We want to have permission in the short term to have that process in play. Also, our responsibility is to come up with funding sources.
I was going to say, can you talk about the partners that you've partnered with before, or I think I had somewhere on a list somewhere a couple of partners. Oh, never mind. I got it.
And I have a slide I'm going to get into some of those too.
Okay,
yeah.
thank you.
Yep. And so then funding sources is another one of our responsibilities to make this work. We do know that we're getting ready funds, and that all has yet to be announced and specifically determined by the IEDC, but we've been given some indications on that. And then we have a number of other We feel the majority of the dollars that are needed for the Phase 1 development that we have secured and feel like we know where those are coming from. So that's where we're at right now. We want to really dive into this design and programming stage so that we can get our numbers more tightly together for the construction and development that would be required for the service providers that would be committing to the space. And then ultimately, going into next year, our goal would be by the end of the second quarter, there's a timeline I'll show you here with more detail, that we would be in the position to do any construction and updates to the site for the Phase 1 developments, and then be prepared by next fall to have the initial service providers be on site operating. And that would be at least 25,000, we would hope, square feet of the 75 to 100 that exist there as that initial phase. Can advance. Just as a reminder, as the process that we went through with the listening sessions, these were the priorities that came to bear from the listening sessions that we did. So employer engagement, and these are different from Michigan City and the other cities that we have spoken with. So employer engagement, I think what's unique about you have a very condensed community here in terms of geography and proximity, and you have a lot of employers around you. That's unique. And how do we engage them to want to be a part of the training and development that's happening inside Cary Gosh, so that those training programs are relevant to the skill sets they need to fill the jobs that they have available. So as we get service providers organized, our next step is to work with the employers specifically, design career pathways around their job needs, and then make sure the service providers are getting organized around that. That is unique to what happens in the real world today, right? Because each service provider is working in a silo, providing the things that they do. They aren't necessarily collaborating to think that if there are, say, 7 key career pathways to the jobs in your community, that takes multiple service providers to engage and complete any training development skills for one career pathway in addition to, say, a certification at the end, maybe. So we would be helping to orchestrate that across the service providers for the employer needs. Another very unique aspect that we learned for your community is technology and youth. You have a young population here, and it was really important to the people that we spoke with that young people are being activated and engaged. It was talked a lot about. There isn't a place for them to go to learn and develop. It could be after school, outside the regular school programming, but we also see it collaborating and working with your school programming. And we have envisioned that your schools would have probably some degree of programming happening inside Cary Gosh as well, that we would be working with you on and your administration team. Technology then being a key part of some of the new skills they could be specifically developing in here. And we do have technology partners both outside the community and inside the community that could be helping to bring coding and other types of unique technology skill development for the young people. Real estate development is also unique to East Chicago versus the other hubs. What we find in distressed communities in general, but obviously Rust Belt, where there's been a lot of remediation of property, what about developing young people into cohorts, learning about how to do real estate planning and development? And so we just today, as a matter of fact, had a phone call with ULI, which is Urban Land Institute, as well as we're working with Ball State. They have development real estate programs that we would like to, for the young people, this would be high school, middle school kids, having an initial cohort of, say, around 10 kids who would be working through programming that they provide to teach them about how you plan real estate, design real estate, and ultimately sell and make sure that that real estate is being sustained. We also see that there could be an adult cohort for this as well. But obviously, developing that skill set inside your own community is quite important because there's so much that can be redeveloped. And so to get people really activated, that is a career pathway that maybe they aren't even aware of today that would really help serve the community as well. We think is a really unique aspect that the group that we worked with on some of these initial priorities really liked. Arts, culture, entertainment. This is a common one that we see is you've got space inside Carrie Gosh that appeals to arts, culture, and entertainment, obviously with the stage area, that leading to the outside space with the track that's around there. All of that can be activated as an indoor-outdoor events center, which we, in the initial budget, have allocated dollars for developing that. And then, of course, the community services. I'm going to get into a kind of a next slide that gets into this, but this would be that wraparound services that's really working on the family services and all of the obstacle removal of getting people into the workforce pipeline that involves the things like, you know, transportation, childcare, those types of things that we know are the barriers, and healthcare, mental health, many of those types of services are what's required to activate those career pathways. And to answer your question about the service providers, so these are the people that we have been talking to. Categorically, you can see with housing, you have your housing authority here that's come up many times in the discussions. You know, CoAction also has a housing program. Some of those categorically, there's been a couple different people that we've talked to with childcare. There's been Geminis, obviously, that we've spoken with as part of Regional Care Group. Food bank, there's, you know, obviously your regional food bank, but we also know Salvation Army and other local service providers are providing those services as well. So we don't want to duplicate what they're doing or compete with what they're doing, but working with them to figure out that the school, for example, has a cafeteria. And what we would see that being utilized as is a way to provide food to the community. That could be food banks that are able to utilize those larger kitchen facilities that are wanting to provide meals to the community, but it also could be someone like an Ivy Tech or otherwise coming in and teaching culinary skills so that people can actually serve the restaurants in the community, partnering with the restaurants on the type of culinary skill development that they would like to see, and making sure that all works together with the food provision aspect. But you can look at that list. I think I've mentioned quite a few of them, but again, those are all people that were a combination of relationships we have and are working on, in addition to some things that have come up in the working sessions that we had. On to the next one. Now, these breakdown, you saw these a little bit last time, but I will touch a little bit on some of just with a couple different levels that are in the building. This just starts to dream about how we would see these spaces based on where they're located. And so you see kind of the green being the recreation, the yellow being culinary. You're seeing that gray area being a potential area where we have employers come in and actually can get engaged and maybe offer services or trainings in those areas. Could be career fairs, job fair type services. We have welcome and gathering spaces, administrative type services that would be provided, arts and theater, obviously in the auditorium areas, and then early learning and education in that larger space, which First Maker Space, for example, is somebody that could be space that could be there where it's hands-on, 3D printing, those types of things that could be happening to teach young people those types of technologies and skills, while there could be other types of early learning activities in that large space that would be occurring or happening. And then on the other floor, you can see we have some flex space, kind of an open hub area, but the technology and learning areas happening up here. And then that community planning, which is the community redevelopment services could be happening up here. So this is a lot more classroom oriented up here, as well as flex space and training and learning areas, as well as with the open area, kind of a more social space where people can gather and share ideas.
I think I know you said you were talking with Ivy Tech, and I think we said IU. So would their classrooms be in the flex space?
Yeah, likely.
If they had any?
Likely.
Yeah, okay.
Yeah, because a lot of times they want a kind of flexible schedule with that because of whatever programs they would want to have
Yeah,
here.
morning or evenings and,
Exactly.
okay.
Yeah, and could be Ivy Tech's helping with some of the culinary stuff on the lower yellow area that was on the other floor as well. So depends on what all service providers we align to that. On the next slide, we have more the site that we reviewed. That really, at this point, nothing's changed there, but just to remind you that obviously the blue space is, of course, Kerry Gosh itself and where we'd be really focusing. The pinkish space is really that outdoor events plaza area that, in coordination with the city and others, really looking at how to activate that to be pretty exciting. I know in Michigan City, we just recently shared with the mayor the renderings there. We are activating we would be for you guys as well. Ratio Design is the architectural group that we've activated to help with the external design initially, and then it'll be internal space design on the second phase. And they have put together some renderings, and they have a very large field similar to this, and it's quite an active, engaging park with multi-use and functional spaces. I think it'd be a little bit different here, but it's fun to imagine how that becomes a real active part of the community with both indoor and outdoor spaces. We had talked about an active park in that upper area, and then where you see this linear park, we actually thought that would be potentially with the real estate development, with the initial cohort of students, that actually could be a project that they develop, is kind of what we were thinking. So we want to dedicate some space to the actual programming that will be happening inside so the whole community can see the results and the outcomes of what's going on. So that could be real fun as we look at that. The neighborhood Woonerf that you see, that's Mike actually had to introduce that term to me, but it's the European, it's a walkway, it's a pedestrian way that connects everybody to that part of the community, because obviously we have some rooftops on what's north of the building in terms of what we're looking at here. And so having that be a passageway that is a real unique, interesting walk, so it does connect that whole part of the property to the neighborhoods that are there. It's usually wide enough that cars can pass along there as well, but primarily pedestrian and bike driven. So it starts to maybe connect with other trails and things that could be happening throughout the city. Okay. Then as we take an a broader look, we always like to consider, and this would be looked at further with Ratio as we did in Michigan City, but we like to see how the site is connecting with the other amenities and assets in the city itself. So here you can see, really looking at a neighborhood mobility corridor on the right side, but really taking into consideration your public transportation and the other kind of redevelopments that you have going on and how it all connects. So we would be working further with the city and other planning people that are working on surrounding projects and making sure it's coordinated and connected so it's as accessible as possible. And I know we've already talked to your transportation for the city as well, and we've already started to reimagine public transportation coming more to the doorstep of the property as well, and they were seeing how those types of things could happen as well as we continue discussion. One thing that we've worked on since the last time we spoke Of course, Ready requires us to have budgets. And being that we aren't far enough along in the design phase to really get specific about budgets, we look at range of what our budget could look like. So looking at the property and looking at square footage development and cost per square foot for different areas, the essential budget that you see here of approximately 8.89 million is what we would see as a 5-year projection of the development or investment that we could see with the vision that we've had be the low end of what would be the amount of money that would be going into the overall property and site. Desired, as we start to look at the outside park area, we start to look at even possible additions for more, I'm going to say, adult learning areas where there's learning labs and people are actually learning hands-on skills. If we want to commit the early education space for children, what about having something like that for adults as well? So we talked about that could be a type of addition later on that could be added. So again, until we really work with service providers and understanding what we really narrowed down to, this is just a broad range. Our base budget for the beginning 2 to 3 years is $6.3 million that we would be investing, and we would see $3 to $4 million of investment going into the property pretty immediately within the first 2 years. So that's kind of what we've scoped, and that is aligned with the Ready dollars that we believe we're getting and the percentage of match that's required to have those dollars and spend those dollars. And as we get those, we of course have to spend them. So that's what the investment would basically have to look like to do that. And Ready isn't our only source of funding for all of that as well. We are hiring, we have a team that we're putting together of grant writers, and we have various federal, state, and regional sources of funding that we are going to be going after for this project. And right now, as you know, Michigan City is the only other hub that we're specifically working on at this level of detail. So funding that we go for will be beyond just what we have in our funding stack right now. For the timeline, our timeline has been that if we could complete, of course we're a little bit past this now, but with Q3 of this year confirming the MOU. The MOU is very short term. It's just basically, I have a copy of it if you guys haven't seen it. It's short and sweet, but it is really looking at between now and probably now rather than the end of the year going into January at this point to give us the ability to go in and do building assessment, some feasibility steps, giving us permission to have access and some control of the site to be able to work with service providers and begin to really plan out the space. After that stage, and it would probably be in January, February, we would be looking for an actual agreement. And that agreement would basically state, and we would work on the terms, but it would be basically stating that we have control to be able to put leases in place, and NWI Works would be managing all of that in terms of the lease with each of the service providers and what that looks like. And our goal then would be to help with you offset the costs that you have for the current operations of the building and the facility. So I think Mike does all that part. I believe we have some rough numbers on what some of the operational costs have been for that building. Some of that would change obviously if it's being used. So we would be factoring that in. We want the lease amounts to be very competitive for the service providers. We aren't looking to make money on this. We don't own it. You know, you guys obviously own the building for whatever period of time you would own it. If you decided in years 3 and 5 would be terms of the agreement that you did want to transfer the building to new ownership and didn't want to own it anymore, then that would all be a part of the agreement about how we would work that through down the road. But we do not see that being that kind of discussion, or whatever your decision might be around that, to be till after what we consider to be the startup phase. And the startup phase is after, it's usually in the years 3 through 5 stages of things. So it just kind of depends. Like, we know schools are struggling, in terms of, they've got more schools sometimes than students, and how you're weighing all that, that's your decision and how you look at that. We've had some schools that are actually wanting to offload the buildings, at some point down the road, and they're just wanting to make sure that this is a sustainable thing before they would make that decision. And we understand too, in Indiana, with the dollar to charter schools, all that kind of stuff. In Indianapolis, we had a project we were working on, and we were able to work through a workaround for that in order for a high school to be transferred over to a very similar type project. So we know that there's workarounds around those types of things if you wanted to. But obviously, you have control of the building. It's your building, and we're just simply trying to utilize the space for your uses, but the others that we've mentioned. As this states, we feel we still could be on track for construction and so forth to happen within the first half of next year, so that we could open by next fall. You have less, it's a good building, it's in good shape. So there's some things we've got to be able to do, but it's less than others, so we feel like we would be able to get it up to speeds for some of the early service providers by fall of next year. Any questions?
Mr. President? Yeah, I have quite a few questions. I'll start kind of where we were at before on your development timeline slide, and you were just addressing that issue of, if I heard you correctly, you said that you were looking at paying essentially for the operational cost only. Is that what I heard?
Usually that's the case, yeah.
And I think I mentioned this at our previous meeting. One of my big concerns is that we have, as Dr. Bornay and Ms. Simmons would know, our budget's challenged, and so just recouping costs to me is not enough for what that building is, as you said, a valuable piece of property. I would want to see that we get not only the operational costs, but something coming back to the school district. I think we have to make money off of this to some degree. I don't want to be greedy, but I want to be sensible. And, Indiana School Board Association tells school boards, we better think of children first. And that's the approach that I'm taking here. So that being said, I want to just put that out there. To the point of I'm looking at the site map, and one of the questions I guess I would have is, there's a lot of activity going on here, but it looks like the parking lot is not going to remain the same. And so how do you accommodate for parking issues? And maybe I'm getting ahead of myself here, but since I have the map in front of me.
Yeah. And are you referring to something that's inside the blue box, or?
Inside the primary parking area.
Yeah, I don't know. I mean, that's pretty much left alone, as is probably what that would have to be, because there's really no other parking nearby other than that lot. So I don't know that we would wouldn't plan on touching that. If anything, we would look how to optimize the parking rather than take it away.
The parking is within this blue square, right?
It is.
Yeah, and then there's the block to the right there that says primary parking.
Yeah, that's the area I was referring to.
Yeah, that there wouldn't be any intention to making that anything other than the primary parking.
Yeah, I guess my point was that it seems if we're gonna bring more people into the building, we would need more parking spaces, but,
We may have to do that, yeah.
yeah. To the point of, and I'm sorry, just have a bunch of questions here,
Okay.
You got, and you mentioned the purple area would be somehow worked with the city or what have you. The other question I have is, who would essentially own this? Because you're talking about parks, are you asking us to turn this over or have, because part of this property is ours, I believe, the active park area so who's gonna own this? Who's gonna maintain it? Is there a relationship? Not all the time does the school city and the civil city agree on some issues. So when it comes down to times like that where there's a philosophical disagreement between the two entities, how does that all get managed?
Well, it'd be our job to help facilitate that around what a plan might be. And of course, that plan's gonna have a lot of discussion with everybody at the table as to what the options could be. You know, and we don't choose necessarily what option you're gonna go with. It's gonna be a representation of yourselves to be able to weigh those out. So to what extent you guys own that, or if the city does at some degree, I mean, we've got to kind of look at that. I don't know if you own all of that. If that's the case, then you already have control of it. The maintenance costs of it would have to be factored into the operational costs that we're recovering from the revenue that would be generated from the activities that are happening there, as well as any kind of CAM potential costs that would be for the people that are leasing spaces.
Just a question, maybe,
Sorry, one more time. We, in this map, we only have the blue and the gray. Is that correct? Yeah.
That's all.
The blue being the opportunity hub and then the gray being the parking.
Right,
Right.
because some of this,
Purple, okay.
That was my understanding. I didn't want to speak out of turn, but it was my understanding that the city owns that. So we would hope that, and just like in Michigan City, you know, it's a much larger area than that. And the city wasn't planning on redeveloping it, you know, putting a big park in can be millions of dollars. So if we all decided that having some active outdoor amphitheater or a park or whatever it might be there as part of that, that would be an extra fundraising effort that we would have to assist with, in this case with the city, because they own that property.
Trustee Gomez, not to, I know you had some questions, but I just want one real quick question. So the one in Michigan City, what was that old land before? Was that all owned by the city, or was it like an old school, an old industry?
It's a track field now.
Okay.
that's what, it was huh?
It was all school?
It was all school too? My question is, how long have you all been in Michigan City with this project?
The same amount of time since we started here.
Oh,
Yeah.
oh,
So it's been a little over a year.
Oh, okay, so you,
They've just been moving fast. Yeah,
oh, okay.
yeah.
Mr. President, if I could continue, I guess this might be more a question for Attorney Harris. This is something that the board has been discussing more and more lately. How would this relate to redevelopment? And this would become a TIF district, wouldn't it?
Potentially. I don't know that there have been any conversations, at least not that I'm aware of, with redevelopment at this point. I don't know if you know the answer to that question, whether or not you all have spoken with redevelopment, and if so,
Been a part of our initial group.
Yeah.
And so, yeah, they're aware that this is going on. You know, they're seeing the potential opportunities, and they've seen, excuse me, I'm getting over something here. They've seen the overall same site plan here that you've seen. So
Yeah.
there's awareness of it. It's just we aren't at that next layer of detail.
what have the conversations been in terms of the extent of their involvement? Like, they're involved for what purpose, or what's the thought?
It was just mainly because from our standpoint in inviting them to the table, and of course, you know, with the schools, we had Marlon on the team. mainly because of transportation routing. And if there's any kind of streets in the surrounding area that need to be reconfigured, like that one, for example, there's just city property related things. And I guess kind of resources that they can provide to help support this.
For just general city planning purposes, it sounds like.
Oh, yeah.
Yeah, okay. All right,
Nothing
I
beyond
understand.
that.
And bigger picture about what the opportunity is.
Get it, yep, I understand.
Well, excuse me, Mr. President, if you don't mind, I have one question about your trades. I see that you were talking about real estate and different other job training. So my concern is, other than just real estate, the other companies or the partnerships that you will be handling, will we be able to put programs in that we're needed in our community?
Oh, yes. Yes, definitely.
I'm talking about not just real estate. I'm talking about programs that our students can leave with skills to make an actual living.
Yes. So going back to the overall, the 5 needs. So where we talked about employer engagement and workforce development around that blue area, the #1 priority, that is working directly with employers on their jobs and career pathways and the skills and training and certifications required for their jobs. And then making sure that the service providers who are providing that training are housed in here, or at least having access points inside the hub.
Thank you.
That's our #1 priority, is that blue.
Pathway.
Oh, well, thank
Yes,
Career
yeah.
pathway.
And
Mr. President, one got you.
these needs came out of conversations with the local community of leaders. We were just listening to what they prioritized. We're not coming in prescribing this for you. We're just sharing what we heard.
I just have two final, I have more, but I'll just final end with these two. Speaking of pathways, the Indiana high school requirements may change, and so how would you see a relationship between what you're trying to establish here and a potential partnering with schools so our kids can meet that pathway?
So CWI was awarded an intermediary grant and one of the career coaching grants from the Commission of Higher Education. So we are well aware of those graduation requirements and have been for the last few months working to coordinate efforts to partner with the schools. So this hub is actually an ideal opportunity, in particular, to provide students with those work-based learning opportunities, as it relates to training and work experiences. So it aligns perfectly.
I'm glad to hear that.
And back to the employers again, designing that based on what this very specific community is interested in and has to offer.
Yeah, thank you. And just a final question. I asked this before, and I think my colleagues felt strongly that if there's going to be a board overseeing this, the board overseeing this, not if, but the board overseeing this needs to have a representative from the school district on it. How do you see that working out?
Terrific.
That's a given.
Okay.
Yeah, that's
Thank
a
you.
given.
If you go back to the map area with the colors,
First floor, second floor?
no, the first, the over, with the land development, or the whole,
Oh, the bigger
Yeah.
picture?
yeah, with the parks. There you go. So the pink and the blue, as well as the active park and the primary parking is all owned by School City of Chicago. The potential Kerry Gosh linear park, anything on that side, east, is not owned by, or it's not owned by School City.
Right.
So we do have the majority of this picture owned by the School City of East Chicago. So just thought I'd share that
So in the
with you.
pink area, you're saying all of that?
That's School City of East Chicago, yes.
That is all School City. Okay.
Yep,
Yeah, because,
Did you do a,
GIS, yes.
yeah, okay, oh,
I got it up.
oh, perfect.
Yeah, and some of our
wait a
discussions,
minute, Joel. Wait.
we were thinking part of that was owned by School City, but maybe part of it city. We were getting a lot of back and forth on that, so, yeah.
Because I think that when we went out there to see this, some of this did flow over into where the West Calumet complex was at.
Mm.
And, it wasn't that much, but the majority of it was the schools, if I'm looking at this right.
Okay, good.
And I believe the city is partnered with, excuse me, Industrial Development Advantage of East Chicago LLC. So all that south of, that, there used to be a project there, is all gone. That's all owned by them. So right now, the part north of that, the Calumet project is owned by School City of East Chicago.
Very good.
So in terms of expansion for parking areas, you know, we can utilize possibly the active park area, since there's really nothing there, if you need to advance your parking spaces.
Yep, very
Meet the
good.
need. I did have a few questions as well. You mentioned, I think, one of your top two slides, the amount of jobs that were posted in the state of Indiana, 92,000.
Northwest Indiana, the 7 counties.
Oh,
of
just the 7
Northwest
counties?
Indiana. Mhm.
Do you know what type of jobs were specifically,
Yes. we-
whether it's more
I
technical,
can't
whether it's
name them
more,
all in this moment.
I don't expect you to,
But they-
just kind of
you
like an
know,
overall.
The top industries are certainly, manufacturing, advanced manufacturing has a lot of opportunity. Healthcare is probably the number one.
It's number one.
Hospitality, and all the pieces that roll up into that, are, that's certainly a major, construction is one of the, most, in terms of projection, projecting the most growth, and that doesn't even include some of the projects that may be coming.
Logistics.
Oh yeah, of course, and logistics, which is a great opportunity, are underemployed.
And if you go to nwiworks.org to the website and you pull up the East Chicago report, you will see this specific breakdown when you get to the market report, but there was also the listening session, and we have some other charts where we broke down for East Chicago, as well as for the whole region, the number of jobs, but the specific jobs in order of demand. And we also have the employers, your top employers, and the number of job postings that they had. So we're using that kind of data to make those calls.
Next, I just wanted to sort of recommend also, we do have a JAG program,
Yay!
because we focus,
Oh.
we kind of focus on the 3 E's, which is, of course, education being our primary, but, employment, enlist, when a student graduates, we want to make sure he's embedded into one of those 3 E's. So I think our JAG program is just taking off, and hopefully we can possibly partner with that as well.
That's great.
Absolutely. We're actually looking to expand, JAG opportunities too, so.
My next question is, what are the target age? Because you mentioned youth in terms of technology youth. What target age are you looking for in terms of youth?
So, I remember it this time. So in terms of workforce development, right, our target population is 16 to 24. And then, of course, working age population, adults, beyond that. That's where the majority of Center of Workforce Innovations funding lands, right? But of course, we know that exposure, assessment exposure of interests needs to happen earlier. Some of that we're going to accomplish with the state's, career coaching grant opportunities, putting us in the schools at a younger age. But generally,
16 to 24 for youth. We have a lot, about 75% of, outside of JAG, about 75% of our funding is focused on out-of-school youth, right? Because they've either opted out for whatever reason, or life happens, and we want to get them reconnected to employment, so they're self-sustaining.
Great.
I'll also add to that Goodwill has some programming for younger youth, but we would also be partnering like through Geminis and other youth-oriented organizations. We're hoping they will occupy space out of here, and that as we get earlier on, that we're looking at that whole life cycle and having service providers that are before the age of 16 too.
My final question, and I believe Trustee Gomez have sort of brought it up, but I really didn't get the answer I was looking for. In your slide, you mentioned site acquisition. I believe it was a slide before the timeline. It said site acquisition. So my question to you is, would you be more inclined in partnering with School City of East Chicago in terms of this? Because then you mentioned agreements, which is fair. The reason why I say that is because not only the School City has significant resources in terms of partnering with students that are here in East Chicago that can be a part of some of the programs that you currently have. And as well as possibly, having these courageous conversations on, I believe what Trustee Gomez mentioned earlier as far as expenses on the building, on, some of the areas around that too, as far as upkeeping, maintenance, keeping everything pretty much kosher to moving forward with your programs. So we haven't had that conversation yet in terms of what we want to do with the structure, but would you be inclined in that conversation as well, as far as?
Oh,
partnering?
absolutely. Yeah, and we see that as necessary, because when we get, if we get the MOU to have our due diligence kind of process to figure out the service providers and the building assessment and those types of things, the state of HVAC systems, all those kind of things that we would need to review to determine how much of our CapEx dollars need to go towards, say, mechanicals versus really truly the space itself, and what needs to occur, because those would be the types of things that we may need to talk to you about, right? That the state of the building in some areas needs more work for us to be able to make the few $1 million of investment that we're looking to bring to the table. So, that's just all open discussion. And I've always had the impression with East Chicago that, you may not want to transfer or sell, let's say, the property longer term. You may not want to. And there may be the opportunity to be able to create, a partnership, because typically what happens after that startup phase is there is a community organization that does run and maintain the facility as an enterprise. Well, however it ends up being 5 years down the road, does it make sense for you guys to continue to do that? Do you want to do that? Or do you want to do that in partnership with somebody else because of what it's become? There's a lot of different ways to look at that. But I have had the gut feeling from you guys that you may want to have a longer term ownership or whatever of the building or part in that. But then as it evolves and these investments are made, does it become part of what is who you are, as a school system, and what you want, to be a part of long term? And that's all yet to be determined. We like I said, we're working with.
We don't have an agenda around that.
We don't.
We just want to bring, a workforce development entity with lots of other ancillary, resources to the community, because I know I can't do it from where I'm at today.
Yeah, and we aren't looking to own anything. NWI Works does not want to own anything.
No.
So this is not developers coming in trying to own something. This is trying to take a piece of real estate in the community and giving it a greater purpose than what it has now, and giving it a greater function and vision for how it can serve in workforce development in communities where we know they aren't getting access to the resources.
Well, thank you very much. We really appreciate you taking the Thursday night to come and talk to us. Appreciate it. Thank you.
Thank you.
Thank you for having us.
If we want to transition to HealthLink. Yeah.
Can you all hear me from this?
Yes.
Okay.
Yes.
All right. So thank you for inviting us to speak tonight. We appreciate that. Nathan Dolan, I'm the Chief Operating Officer for HealthLink, and I have some of my team members here with me. I got Maria, who is our site director for our East Chicago clinics. I got Vanessa, who is our Assistant Chief Operating Officer, former site director for those same clinics, and previous student of this school, I believe she said. She'd like to point out she knew where the detention office was, clearly. And then we have our outreach and enrollment coordinators for the community as well, Nilly and Michelle, who I believe you guys already know. They seem to know everybody everywhere we go. So what we wanted to talk to you all today about was how we have been able to partner with the school system so far and how we are participating and work to support the local community, as well as how we can continue to grow that partnership with the school and see inputs and insights into what you all feel like may be needs that we haven't identified yet or don't know about, and may be able to help with some of the service offerings for those that you're encountering at the schools. Does that sound all right? Do you have any questions before we get going?
That sounds good.
Okay, we do have some handouts. We got some like single page flyers that if you're okay, they'll hand out to you up there. We don't have a formal presentation.
That's fine. Yeah.
Okay. So with us, I know when I first started at HealthLink, one of the earliest things or programs I participated in was when you were having all the lead issues out here, and we brought around the mobile unit and we set up in the community and we cooked hot dogs, we had, bounce houses, we had all this stuff out there to bring the community out and do free lead testing for those that were at high risk areas. It was really insight. It was my first real in-depth insight in East Chicago and getting to see the communities and everything from there. I'm originally from Virginia, so I continue to learn, Northwest Indiana, even though I've been out here for about 12 years at this point. But it really got me just totally bought into what we do at HealthLink and what we do for the East Chicago community, particularly. Another thing is recently to grow our own engagement with the area and to continue to be member and participant in the communities as I recently joined the Ivy Tech Board of Trustees for Lake County as well. I got to have my first meeting at the East Chicago Ivy Tech, which was, great to see and participate in. So we're really excited about that. I want to hand off to Maria for a minute, let her tell you a little bit about some of the services and what we offer at those clinics, and then talk about some of the future ideas and how we have been engaging with the different programs like what you just saw in Michigan City, and how we've been able to grow that relationship with the Michigan City school systems as well there.
Thank you, Nathan. So can everybody hear me?
Yes.
Okay. So we've been here at HealthLink has been here in East Chicago since 2013. We have been actively involved in coming to the school since then, providing sports physicals for all the kids during sports seasons. We've been actively just, in the community as well, like Nathan said, providing services wherever it's needed. Our clinics, now we have 3 locations. We have family practice, internal medicine, pediatrics. We have optometry, dental. We have the mobile bus unit. We have the pharmacy now that just recently opened. Our newest location, which is on Broadway, well, they're both on Broadway, but the one that holds the pharmacy has like a more of an open access immediate care type. We have multiple partnerships throughout, the area as well. We partner with the food bank. We have a medical legal partnership as well for our patients. This is something that, if our patients come in and they need some type of legal advice or consult, we're able to get them access at no charge. As long as they're our patients, if they need some type of case, they'll we send it to them. If they can take it, they'll take it, and the patient doesn't get charged for anything. We provide a lot of services actually, and we're happy to serve the community, and we're happy to come out here and service the children when it comes out to sports physicals, because I know a lot of that is important for them. Especially when they're out there, playing those football games or those soccer games, and that's something that they want to advance when they go off to college, because they want to, go for a scholarship or something like that. We're really happy that our providers are more than welcome. Most of our providers have been here in East Chicago. They're born and raised in East Chicago, and I think most of you guys know them as well. But I think that's about it for us. Mm-hmm.
I think we have a video of our pediatrician and former chief medical officer playing some pickup basketball with some of the kids during those leg screenings too, which was pretty awesome. We do stuff on top of screening for social determinants of health. It isn't just about that initial health of the person and the children and adults that come in to see us, but the overall health of the person and how much of that happens outside of our four walls, and how we can help to have positive impact on that with the community as well. Some of the stuff that through the relationship building that we are seeing and participating in the programs like you just watched with Northwest Indiana Works and the Michigan City Project, is we have been able to increase our relationships with economic development group there, the mayor's office, all of those as well. And just recently on a meeting this week, when we talk about job opportunities for kids coming out of school, they are engaged with us about doing a bus tour around different last year it was factories, what they can do in that kind of world. This year it's around healthcare, and they're trying to do for their counselors to get them around to different healthcare organizations, see what kind of job opportunities are available in healthcare. As you heard them say, that's the #1 need in the area. It's pretty much almost the #1 need in the country, more or less. They asked us what the highest area of need was. We talked about dental assistants and medical assistants. And they had mentioned at that time that they thought through their technical program about doing a dental assistant program. And that is something that we've actually started up internally, where we have our own dental assistant and medical assistant programs, but we have a lot of limitations in terms of the size of the cohorts that can go through those at each time. So we've been able to connect them with our Chief Human Resources Officer that developed that first program to help support some of that stuff if they wanted to add it to their technical programs, and then make sure that the counselors know that even though that can be viewed as an entry-level position, that we have had people grow. My current director of quality started as an MA at HealthLink and is now a director over our entire quality department. We have licensed practical nurses that have gone for that certificate at Ivy Tech and are now nurse practitioners at the organization as well. So it's not just about that this is a kind of one and done thing, but helping envision the growth and how they can grow into the industry, especially in an industry that is typically recession proof, more or less, and will always be here and offers tons of opportunity for maneuvering within the healthcare system. So is there anything my team would add that we have not already? Yes, enrollment specialist for health insurance as well. So we can help with Medicaid, Affordable Care Act, marketplace, insurances, Medicare, pretty much anything with that. And that is special programs for kids, any of that stuff we can help with enrollment and education. And we actually help through the full submission process, help with follow-up and any documentation that's needed if something's kicked back. Presumptive eligibility, where we can get them access to health care that day if they don't have all the information they need, but they seem like they'll likely qualify, and we help them with the follow-up so that they get coverage until they get that Medicaid determination at that point. So 340B program too. See, this is why I brought a team with me. 340B program is it's really good for a program. If you are a HealthLink patient and you go to our pharmacy or any of our contracted pharmacies, which typically includes like CVS and Walgreens, it can get significantly discounted drugs. It's a program that the government does and funds that allows us to get them as close to cost as possible, which can save, I know when insulin went up a ton and there was that whole thing around that, we were still able to get it to cost and save people thousands of dollars, save essentially rent payments worth of money on drugs to try to keep those costs down for our patients. We have clinical pharmacists on staff that help with education around the medications, how to properly use. If the people end up with questions about any access to them, we have the bus that goes around trying to get people to remove barriers to get their medications, remove barriers to coming to the clinics, and pretty much anything we can do. Yeah. All right. Got anything else? Yeah, okay. Mobile Integrated Response Team. Yeah.
Yeah, I appreciate you all. You come out and you do the physicals, and thank you all. I know the ladies. Is there any possible way that we could get some help? Possibly with we do not have certified.
Speaking to the mic.
Oh, all right.
You are.
Just interested in if there was a possibility of where you can help us with athletic training for us.
I do not have a yes or no answer today, but I am happy to explore it. I was hoping that stuff like that would come up that maybe we haven't thought about before, or even really gone down the route to evaluate at this point. I think that's a great question, and if it's a need, I'm happy to take things like that back and present it to the rest of the senior team and see if these are options and stuff we can do to help fill a need, particularly medically. Thank you.
Yes, I want to ask the question. I know I came to your new facility that's on Main Street. Is that Broadway? I'm sorry, yeah. And I was in there, and I see that you do have a pharmacist in there. So I was wondering, so now, prescription-wise, anybody could come in and bring the prescriptions there, or how does that work? You work like Walgreens and CVS?
Yes.
But
Sorry.
Yeah, go ahead.
Yes, you don't have to be a patient to come to our pharmacy. You could just bring a prescription from your doctor, and we're more than happy to fill it.
Oh, okay. And I
But the-
Piece is specific to the 340B program
oh,
within
oh,
pharmacy.
oh, you say what now about the 340B? You got to be in that program to come to you?
That is, you have to be a patient to participate in that with us, but you can come to the pharmacist for anything, but you won't get the discounted 340B prices without it.
Yes, don't
That's
say,
it.
cause the 340B program is the discount program, right? That's what I'm looking for. But anyway, but anyway, I know that you're there, and then too also, now your food bank, how does that work?
Vanessa?
So our program is called Food is Medicine.
Called what now?
Food is Medicine.
Oh, okay.
And to participate in that program, you do have to be a patient, you have to have a chronic condition, and you have to have a food insecurity. Part of that program, you get to work with a dietitian where she's able to provide nutrition management assistance at no cost. We're also providing a monthly food box to patients. They're medically tailored food boxes, which means no sugar, low sodium, because we're tailoring it around that chronic condition of diabetes, hypertension. In East Chicago specifically, Foundations of East Chicago, thank you, they were able to fund us with additional funding to provide a voucher to patients. That voucher, patients are able to take to the local Strack and Van Til on Indianapolis and redeem it. It's $20, but they could only purchase fruits and vegetables, milk, eggs. So we're really strict about the type of food that they're able to get, but that's because we're monitoring their condition. That program has been going on for about 2 years now across all of our clinics. We have 1,000 patients enrolled. We've completed over 2,000 orders. And in total, we have about a 40% improvement rate with patients' conditions. We've lost over 200 pounds across different patients. So it's a really great program. We rely on funding to keep up with this, so we're hoping to be able to continue it, but the need is definitely there where patients are needing the resource of access to food and the added resource of the dietitian council.
Okay, well, thank you, because I know that you all are out very active in our community. I know I see you two all the time. And this, thank you.
All right, well, thank you. Sorry, does
Hey,
anybody
Mr. President, I
Yes,
do have-
I just have
a couple more? Sorry.
I'll just go, one question. Is your, there's a great need in this community for people who have moved in here from other countries. Do you service those individuals?
We service everyone. Doesn't matter whether they have insurance or not, no money, we see them regardless.
The reason I ask is I just spoke with my niece today, and she told me she walked into a house there, here in the harbor, and, there are people there with like, I think there was two families, 8 kids, they had 1 mattress between them, and so they have lice issues and so on, so
We
they're really in
actually,
need.
sorry to interrupt, we actually also have a community health worker that can help with resources.
I
So if
appreciate
someone's
that,
in
yeah.
need, they can come to our clinic and we're able to help them out as well.
I appreciate that, thank you.
That's any site, right? Any one of your sites?
Any one of our sites, yes. They can get a hold of her. She works with all 3 of our clinics, but they know how to get a hold of her, and she's at the harbor location once a week. But if she needs to come up more, she will. But she's more than happy to help.
Thank you.
I just have 2 questions. One is, who funds HealthLink?
It's a trick question. We get baseline funding from the government. We're a 330 C grantee. That is, so when you talk about funding cliffs and the government looking to refund health centers, it is that which is about maybe 10% of our operating budget. We have a lot of grants that we get funding as well. So we did just get awarded another government grant. I want to say it's $2.5 million over 2 years, and it's specific to colorectal cancer screening. So working on preventative cancer screenings like that. We get to hire a person for that. We have program managers that end up helping us implement these. And then we draw them down like any other grant that we would. And then outside of that, it is revenue generating visits, right? So when she talked about we see anybody, I would say our largest payer by, hands down is Medicaid. FQHCs were established in the 60s to help increase access to the uninsured and underserved. We provide high quality care to everybody. We take commercial payment, we take Medicare, and we take those that don't have insurance. We try to help them get insurance, as much as possible, but if they can't, then we have something that's called the sliding fee scale. So based off of their income and where they fall on the federal poverty level, if they're below 100% of federal poverty level, then they'll pay $25, I think, for a visit. Is what the out-of-pocket would be, and they get discounts for labs. As is a part of trying to increase access to healthcare for us, we contract with Quest, and to contract with us, they have to adhere to the same things and offer the same discounts that we do to keep costs down for individuals. It goes up to 200% at that point. Anybody over 200% of federal poverty level, it is what a full visit cost would be. We're required to do that, which goes into like our reimbursement that we get through private payers and the government. But it is significantly Medicaid patient-based, roughly 50%. I would say the sliding fee is about 12 to 14% of our patient base. Same for Medicare, and then commercial pretty much fills in, the balance of it.
My last question is, this may be a trick question, but have you ever partnered with School City of Chicago?
We have partnered with them on multiple things, I would say. I'm going to hand off to some of the history, my history buffs over here for it, but yeah.
Yeah,
Yeah, I'm talking about specific.
at the gym.
Yeah, the way we've partnered is we've come out and we've done the physicals at the gym.
That's right.
We've pretty much that was like our summer thing. So every year. We would come out with the mobile bus to come out and do it. I think at one point we were also doing school physicals at the fitness center, and then the back to school rally. We would come there too. Yeah, so we've done that as well.
And the reason why I'm saying that, because those seem like indirect sponsorships or partnerships on just dealing with just some of the needs of our departments. But it seems like you guys have more resources to offer, but it seems like we haven't engaged in those type of conversations yet to see how you can actually embed with us in terms of a full partnership, to see how we can possibly even work with our students and their families in Chicago.
That's a part of us being here tonight, is to look at how we can grow that partnership, because we do have based on the school system, we do more with different school systems, and we have patients that don't even understand, as much as we try, the full scope of what we do. And when we talk about programs like our Mobile Integrated Response Team, our MERT program, and peer recovery for those that have addictions and how we can help them, they quite often think this is like a county or state funded program that we work with when it is our program. Like, we got grant funded for that specifically through the state, but we built it, we implemented it, and we manage it through our behavioral health care department. So these are the things that it really is that to get and continue this communication and this conversation and figure out what you all need that you can leverage that we already have, and then maybe what we can't, hopefully we can do, no promises, but that we can do things like that and start to build and fill in the community need gaps from when they're a kid, that they can stay with us all the way through their adulthood and they have that continuity of care and that relationship building. You know, we try our best to have our board has to represent our communities, and 51% or more of them have to be patients is a HRSA requirement. And then also, if you walked into our East Chicago clinic, I think you would see it's representative of the community that it serves. Significant Spanish-speaking staff, number of staff for that. And we have seen that from our community health workers and some of the undocumented individuals that come in, or just the migrant workers that are here, you know, legally, or however you want to say it, that they build a relationship with that community health workers. They get established in the community because they help them connect to so many things. And we've seen those relationships where they don't want to talk to anybody else. They come in for things way outside of their health care, but they get those community services because that's what the community health worker is there for. And we don't turn anybody away for any of that stuff either, right? We're here to help, not just on a medical basis, but on a community basis.
I'm definitely
I
looking.
just want to add, oh, I'm sorry.
I just had one
Go ahead.
comment. So I'm definitely looking forward to seeing that agreement.
Excellent.
Okay, I just wanted to add, hi, Mr. Dolan, I'm Dr. Yanders. I'm the one that couldn't get into the Zoom meeting the other day. So, no, so we have been working, well, Nurse Bobo actually has been working with them and bringing me into the loop and trying to see how we can get them into our schools to have the clinic back at Central High School. So I just wanted to add that, so we are looking into it.
All right. Well, thank you very much. We appreciate your continued partnerships with us, and we appreciate your community involvement, and thank you for taking the time on your Thursday night to come talk to us, and hopefully we can get something passed here soon. We can continue to solidify our partnership.
Thank you.
I
We'd love that.
appreciate it. Thank you.
We had a comment back here too on the. Come on up. We got advocates.
We set up professional development, and they're constantly coming in for professional development, and every time we have community activities, they're always with tables for our parents, helping out, whether it's the pre-K center, the high school, at all locations. So we're constantly setting up with them. That's how everybody knows Miss Nichelle and Miss H.
That's right.
Well, thank you.
I think that was specific to leadership I was going to do at some point. Yeah. So yeah, we're trying.
Much appreciated. Thank you.
Thank you all.
All right, how about we take a little 5-minute break, and then we'll continue on with our work session. next part of our board meeting is going to be, or the next part of our work session is going to be our pre-board meeting. So Dr. Bournet is going to go through not all the items, but we're just going to highlight some of the items that are in our agenda for Tuesday. So we have Mr. Gordon here, and we're going to go ahead and start with the sports positions first.
Correct.
So if you want to.
So the sports positions are listed as 6.12, 6.13, 6.14, and 6.15. And we'll have Mr. Gordon begin.
Okay, we're looking to hire 3 athletic supervisors. 1 athletic supervisor for the high school, 1 for the middle school, and 1 to work with the elementaries. All of them will work with me. We're doing this in lieu of hiring an assistant athletic director, because this will allow us more bodies that we can get many of the things that we need to get covered. One of the things that we look at is our campus is not one place, one location, like many other schools. Some of the schools, their middle school is tied in, so it's easy for one single administrator to cover it and get some people to do it. Now, if you look at what I gave you before what I presented to you, you can see that the average cost of an assistant athletic director just from our area, so those are the schools that are in our area, is about $86,000, okay? What I'm looking to do, if we could get 3 supervisors, 3 supervisors at $15,000 for a 10-month contract, okay? That will work out to about $1,500 per month. And we hoping to average about 20 hours per week with that person, which would work about $18, $19 an hour. The reason we did not, I asked Dr. Bournet and Ms. Simmons to make this a non-ECA position, because we do want to have people who are interested in a position to come in and apply from the outside. I think it gives us more flexibility. I think it will allow us to have coverage across all of our campuses, and I think we could do a lot more.
Okay, so.
Questions?
No, so you want them part-time and not part of an ECA stipend?
Correct.
Correct?
Correct.
And then for an average of probably about 20 hours?
Yes.
And then the elementary position, they're really just going to be, what do you envision that position to be?
Well, we're going to grow. We're really looking to grow some of our programs. I know that one of the things sooner or later will be coming before you, because as you can see, girls wrestling has taken on boys volleyball. There are many sports growing. But the biggest thing that I'm looking to do with this is hoping that it will strengthen our feeder system. And as we look, we want to continue to have programming, even include in the summertime. So that's the big goal.
Remind me, so I'm not really used to like the elementary sports schedule. So what is typical with other districts? Do they just focus on 5th and 6th grade? Or is that what we're going to be focusing on as like more solidified sports, and then maybe the younger grades go more intramural type stuff?
That's some of the things that we're looking at. We're looking at 5th and 6th grade. We're looking to make sure, one of the things we want to do, we want to add some sports at those levels. We want to get our soccer program going at the younger levels. We want to have more than just boys and girls basketball. Mm-hmm. We want to look at even the thing of trying to improve our track program at those younger levels. Baseball program, I got some people interested. And this came about because there are people that have come up to me and say, why don't we do this? And I'm speaking with our principals. We try to talk weekly and what we can do to strengthen the athletic participation at the lower levels.
So that one area, I did mention to you about this. One school has a girls wrestling team, and you know who I'm talking about,
Yes.
and she's tough. And I just want, I just want to know, and I think she's in middle school. Yeah, she's in middle school, and girls had never wrestled before, but when she got into it, it's really kind of widespread now, because I think Maryville has it, Crown Point has it, and these young ladies are awesome. They're really awesome. I would like to see something like that, not only just with the boys, but with the girls. And then maybe that would help them, needless to say, help them work off some of their frustrations. I mean, with the exercise, because, you need to use that energy, and you're focusing on building your body, and you're focusing on,
I agree.
your training, so you don't have, and your education.
Yes.
We can't leave that part out. You got to have a certain grade point average. So I'm just saying, with that would help them build not only their character, but also their self-esteem, and to basically how to handle situations if if there was a confrontation. So, I'm just for it. I just think it was a great idea that the
One
gentleman
of the things
came up
that
with
I
the
think
wrestling.
sport helps with, especially at the younger level, is conflict resolution.
Yeah.
Okay, and taking a lot of that energy and use
Yep.
it in a positive way. So that's what we're looking for.
I was having a sidebar with Dr. Bornay, and I think the one thing I would like to see on the job description is to maybe list off the sports that we really want to start kind of building up. So I know we said boys and girls basketball, but then also maybe add on the job description the other sports that you think we can really like pilot and start building a program that first year.
I can tell you what we're looking to do right away.
Okay.
We're looking to build our soccer program. Okay, that is big, and we're looking to grow our baseball program.
Okay.
I got people who are very interested in doing that. They have the skill and background, and they just want to get started.
All right, so is it fair to say, like, when we think about the elementary kids for 5th and 6th grade, their spring sport would be, or like, not their spring, fall would be soccer, boys and girls soccer, and then transition to like basketball season, and then transition to baseball season?
I would love to see that happen. Again, we still got the volleyball things going on. Okay, so we don't want to just rob the other sports, but we do want to add them, and I hope that's the case.
Okay. And then for the middle school, I know we said that we wanted to strengthen the track and field program, but then, well, never mind, because then it's going to be all the middle school sports, pretty much the same as the high school, that we want to grow into our feeder. So, all right.
Yeah, Mr. President, I
Yes.
want to ask a question to Mr. Grayling here. Our wrestling, boys wrestling. I know you've heard a lot about this, and I'm going to just, I don't know much about the sports itself, but what I don't understand is, I know that when we have this big wrestling thing that we go through, and we have it at Central High School, I don't know what it's called. What is that called?
Semi-state, we have we host the sectionals, which is somewhat big, and we host semi-state, which is about 70 other schools that come here.
Okay, but our kids, we never, ever be able to participate. We
We do.
never.
We do. We
Well, I
have
know
2
we-
kids.
Well, no, we do, but we're never where we should be when this big league comes to our schools.
Well, because it's a,
I'm asking,
oh,
Ms.
okay. Yeah, go ahead.
I'm asking. I'm
Okay.
trying to get an understanding of that
Okay,
because it's been a
so-
lot of talking about the wrestling
Okay, what
itself.
happens there, trustee, is that just like we have sectionals in boys basketball, if we lose, you're out. Okay. Being that wrestling is a team sport, but it's also an individual sport. So that person can advance as an individual, even if the team doesn't advance. So we have had wrestlers to advance to semi-state. Last year, we had 2 to advance to semi-state. and
Well,
did pretty
okay.
well.
Well, and then too, I'm in the gym I'm there in the gym.
Yes.
I see certain coaches in there interacting with the sports that they are coaches for.
Uh-huh.
And I see a lot of the kids that are in there that, like I'm speaking wrestling kids. And I don't see any kind of interaction going on with their coach. So I think whoever their coach is, from what these kids are saying, they're not getting to the full extent of what they want to do in that
Okay.
sports.
Well, I do know that, and I know the last 2 weeks, and one of the things, again, we trying to change from how it used to be to the way it should be. And we're trying to get the coaches to understand that this is not just only during the season time that you work with the student athletes. This is pretty much that all year round type of situation. So that's understanding that we're going to do. I'm working with my coaches. One of the things that I'll add, Dr. Bornay has instructed me to have, not a getaway, but help me out, Dr. Bornay, what we call it? Training with all my coaches, where we're going to talk about what our expectations are truly for the district, not just for their sport.
Okay.
Oh, I just want to echo that. I think that's good. Like being like a high school coach myself, it's always like you want the success of your own sport, but then we're really not doing the kids justice because they need to be totally involved all year with
Exactly.
when they're in their sports, moving their body. We got to really look into, like you said, building the whole athletic program and not just the individual successes of the individual sports.
I agree. One of the things that we do here, and I appreciate that we do it, is that we do share athletes, okay, which in a sense makes very good sense, because if the athlete goes from one sport to another, now you got actually two sets of eyes from head coaches that's being able to have an impact on their student's life.
Can I ask you?
Yeah, go ahead.
So, with regards to your coaches, do you focus on just keeping these coaches in one role, like say for example basketball, or can you commingle these coaches to work pretty much all season, all 3 seasons?
Let me say this. Many of the coaches that we have on staff now, they were in place when I became the athletic director. I think maybe one, maybe two coaches that I brought on. I would say again, we are trying to get our coaches to grow. We're trying to get them, our coaches need some training. Our coaches need some training, and that's what's required. We do have coaches that work with multiple sports, okay? Some are easy to work with. Football is easy to work with track or cross country and track. Those things happen. We got our girls basketball also working with track, but their athletes are, some of them their primary sport may be basketball. And then they go over and they run track or whatever the case may be, run cross country. It's easy for that coach to go over there and work with them, if that's possible.
And my last question is, do you allow teachers, do you ask teachers first before you put it out on the job description out on the, how do you, on the website, how does that work?
I talk, as a teacher, I talk to many teachers, and I try to get them involved any way I can. One of the things we do, we invite them, they're allowed to come to all our sporting events at no cost, just with the ID. We want them to be a part. I tell you, one of the people I work with on a daily basis is Frank Porras, okay? He just helps so much with what we're trying to do with wrestling. So we do offer it to the teachers if they're interested. But I can tell you this, if you look at East Chicago, what we pay our coaches, we're like close to last, okay? And many of the coaches talk about that. I have discussed that with our superintendent, and I know it's being addressed. I think, coaching is hard. If you ever coach before, you'll know that it takes a lot of time. You spend a lot of time with the kids, and a lot of times you hear people say, well, they just want to do it. Yeah, they want to do it, but at the same time, they feel that they should be compensated.
I had a follow-up question I was thinking of. I know we said, I think, what was it, $15,000?
Yes.
Yeah, do you think that would be a better number, or do you think it would be better if we have timesheets and they just track their time and how much they work and give them a flat hourly fee? Or not hourly fee, hourly payment?
I don't know what hourly costs would be to do
Yeah,
it.
I mean, if you just had to,
This
like,
is,
That would be illegal.
I did not come up
Yeah.
with the 15,000 just out of the blue. What I did is I contacted a lot of schools, okay? And I asked what they were doing, because they were having some of the issues that we're having here, okay? And I said, what are you doing? Okay, how is your middle school? How is your elementary school? What are you paying them? And different things. That's where I came up with that.
okay, all right.
And I can tell you, if you look at the handout that I gave you, many of the schools, not only do they have athletic supervisor, but they also still have an assistant athletic director or two. So that's in there. Wanted you to see that.
Yes?
And the predicament that he's in.
Yeah, no, I do. I'm trying to figure out how we compensate.
Okay.
Yeah, I'm trying to figure out how the best, my question was how is the best way that we compensate
Okay.
these coaches?
Okay.
Because it is a lot of work, it is a lot of time,
Yeah.
and you do pour a lot of yourself out. My thing is just, I'm gonna be honest, I don't know who,
If we compensated coaches on a timesheet, we wouldn't be able to afford them at the high school level.
oh, no, I'm not talking about the coaches.
Oh, okay.
I'm talking about these three positions,
Yes.
to pay them maybe on an hourly level.
Well, what we
Or,
talked about
it-
doing is just having them as, because it would be open to teachers if they wanted to do it in there. It's open to the public. If they want to do it in their off time, that would be okay. But I can tell you, it would be difficult if we just said, if we were going hourly.
yeah, okay.
So when you, excuse me,
Yeah, go ahead.
when you offer it to the teachers, now do they have to be knowing something about this sports?
Oh, yeah.
Oh, okay, that's what I want to know, cause they sound like to me like, okay, so they have to know about the sports.
Well, they gotta have, yes, they have to have a background in athletics. They need to know
They
something
ain't just say no
about
teacher, right?
athletics.
Okay, well,
Yes.
say that then, cause it made me think.
There's the job description,
Yes, it is.
yeah.
Oh, it is?
There's
Yes,
a
it
job
is.
description, it's on the draft of the board docs. But, there's a job description, it says something like,
For teachers.
something about some type of degree and at least a year coaching experience and.
Or, yes.
So-
So, yes, it's knowledge-based as well.
Okay.
All right,
Mr. President.
yeah.
Yeah, and I believe you were asking a question, not as a coach, but as a school board member, so I can appreciate that. I just have a couple questions. One is I see schools here with 20-plus sports. What are the four sports, for me looking at 23, what are the four sports that are not in play here in East Chicago?
Well, I can tell you some of them right off the top of my head. Well, we do not have girls golf. We do not have girls wrestling. We do not have boys volleyball. Yeah, oh, yeah, we do not have, flag football for girls, which is coming.
Black football, whatever.
We do not have gymnastics that a lot of schools may have.
I know there was a conversation about us, and sorry, Trustee Gomez, if I'm cutting you off. There was a conversation, I think, that we wanted to add bowling as a sport. We do not have bowling, right?
We do not have bowling.
Have you, has there been an opportunity where we've sent something out to the kids to see what sports they would like to participate in so that we can add some stipends to those coaching positions?
We have, in a sense, okay, not directly. Most of the information that I get is coming in either from the community or the kids themselves, actually saying, Coach Gordon, when can we do this, or why don't we have this? So that's most of the feedback, but anything that's hard copy, no.
I'm sorry, Trustee Gomez.
Thank you for stealing my question. And that's where I was headed towards. Miss Lott, I can't remember her first name, but she was one of those individuals who came forth and asked us to consider adding bowling in some form or fashion. The other question I have, and I know that my comments at another board meeting were taken completely out of context, but I always look at the student athlete, and student comes first. What are the GPA requirements for our athletes?
Our student athletes follow the state guidelines. We follow it directly. We'll put it in place. You need to pass 70% of your courses. And that's the main thing. It doesn't give you a direct grade point average. It doesn't require a direct grade point average. It says that you need to pass 70% of your courses.
Really? No
When
grade point average?
Trustees Rodriguez and I were on the board at the time, and Dr. Joe came in and elevated the GPA for our kids, because if there's if we don't raise the bar for our children, our student athletes, they're not going to go there. And I don't know, Trustee Rodriguez, do you remember what that number was? Was it 2.7?
Yeah, 2.7 or 2.9.
That's the grade
Yeah.
point average?
No, it wasn't. It was a 2.0.
2.5?
It was a 2.0.
2.7, that's a,
No,
yeah, I mean, the C average is a 2.0.
that's what it was. It was a 2.0. It was when it was changed. The change was made, I believe, when Ms. Wright became the superintendent.
Oh, excuse me, I want to ask a question.
And before
Go ahead.
you do, if you don't mind,
ahead.
I would ask that we have a conversation about this, because having kids participate at the very base level and not raising the expectations is what we're going to get from them. I know we have a lot of good student athletes. I know that. Some of them are on the honor roll. Some of them are in National Honor Society. I appreciate that. I think we ought to raise the level for all our kids. And so I'd like to have a discussion with Dr. Bournet about how to do that, because when Dr. Joe came in and elevated that GPA, the kids met it. And if they want to play bad enough, they will meet it. That's all I have.
You know, I think that's, I'm sorry, Trustee Gibson, but I think that kind of goes back to, I'm curious to see what the GPAs are, and then we can start from there.
And I'll be happy to get those for you.
Yeah, my question too is, I did not know that, I heard you say the principal sets the GPAs, not the state?
The state sets the GPAs.
Oh,
The
but I
state.
heard somebody say that Mrs. Wright said it at 2.0. How
No,
was she-
the superintendent can set it for the district or the school board.
Oh, they can set it for our school, but there is a state,
State mandate.
yeah, the state mandates it though, right?
We could go,
It can't be below the state mandated.
Well, let's
Right.
put it that way then, so
Right.
I don't even know why we let the principal do it if it's going, if it's, they putting it below the state. So we going with the state, right?
And that's what we've been going with, what the state
Okay,
has required us to
mandate.
do.
Okay, that's what I like.
what I'm
Well, no,
suggesting, Trustee
He-
Trustee Gibson King, what I was suggesting is that we raise the bar for our kids. I think we'll be surprised that they'll meet it. that was the experience that we had, Trustee Rodriguez and I think if we do that, let's see how our kids react. I believe they'll step up.
And just,
Understand what you're saying. Supposed to do this ASAP for the next school.
I think, and I can add, if I can add to what Trustee Gomez stated, you know, even if it's a 2.3, you know, something where, because it seems like prior athletic directors has been cited by ISHAA for our children playing below the bar. Let's be real. And I think, and of course, it never happened to you, but that's been our prior. And I think what we did was sort of raised it a bit so that we were able to allow students to not only reach those averages, but it kind of puts them on a border where sometimes students just can't make it and
Trustee, let me say
they're still
this.
playing.
Okay, students have to be cleared or certified in order to play, okay? And the state, there's whatever that particular GPA or in this situation, 70% of your classes, we have to submit that to the state for them to be clear, okay? So if a student is playing below the bar, then we're in violation. And that AD certified somebody that probably should not have been playing.
Well, I appreciate the
Right.
discussions around this because I think it just goes to the bigger issue of how we, you know, put our kids on the right track. You know, I mean,
Exactly.
we can have further discussions on what our numbers are or how we motivate and progress and look at the student outcomes, but I think this is a very good start.
I agree.
Okay. Does anybody else have any questions on the supervisor positions? All right, well, thank you very much.
Thank you.
Fitness center. You have any questions about the fitness center?
Do you want to, is that Grayling too?
That's great.
Oh, Mr. Gordon? Oh, I forgot, we have, the fitness center position.
Oh, when you say the supervisor's position, what do you mean by that?
Yeah,
Is it on the personnel report when you said?
No, we're
I didn't know that the fitness center was on a part of this one.
top titles.
The fitness center coordinator and the strength coach.
That is a position that was previously there, okay? Actually, they had two positions that were there, working with our kids and also with the community. We're trying to bring one of those positions back because we do not have enough coverage over there in the fitness center at the rate that we're going. We've been doing here lately is using subs, and some of the subs are substitute teachers, and we're paying them at the $40 an hour rate. We're paying them at $40 an hour. Okay, so it's costing us a lot more money.
Are these substitute teachers?
No, they are regular teacher, but they sub in the
Oh,
fitness
okay,
center
okay.
after their duties are done teaching.
Well, even with that question, you know, are these, because I obviously see the need, but are these teachers that have been going to sub in the fitness center, are they licensed
They're
physical
certi-
education
They're
teachers?
certified by state that they can work in the fitness center. They can. They're
Okay.
not strength coaches or any of that. I guess one of them would probably qualify. He's a teacher that teach weightlifting and
Okay.
something, forgot his other class, but he's also our department chair.
Yeah, but
so.
he's just going and just looking like, or these people are just going to just to supervise. They're not
Yes.
working out and teaching the
No.
kids, giving them workouts.
No,
No, okay,
no.
okay.
And this is what we want this person that we're trying to bring aboard as part of it.
So it'll be more of
his-
a strength and conditioning coach for the whole district.
Yes,
Yeah, that would be working with all the sports.
yes.
Okay. Yeah, because
Now-
that's my biggest. I'm a coach, but I can't teach kids how to use a weight room.
Okay. Okay,
I
and
couldn't
one of
even
the
find it.
things that, again, at one point, it used to be, I believe, 3 people in the fitness center, and now we down to 1. So we must have at least 1 to come back there.
Yeah.
If we're gonna continue to operate it.
Okay, well, thank you.
Just,
Or, sorry, go
yeah,
ahead.
just on that note, I remember Dr. Abrego bringing that issue up and having a conversation about the certification of that individual. So I think before we move forward, we should revisit that.
All right, well,
Okay.
thank you. Thank you very much.
Yes.
What's next?
Dr. Yanders has priority 1 dispatch, money line, top 20 amendment, SCL alternative training. Okay. 0.08 to 6.1111.
Glasses.
Yeah, it would be.
You know, but like,
The hell is that? Oh, yeah, we're gonna change that. About that, because I'm gonna have them,
which one do we have first? Or, sorry.
this is just.
6.08 priority 911 dispatch.
Funds that she's being paid. I know Leslie, but the lady. Okay, so this memo is to train Mr. Conover over at Central High School to provide our students with 911 dispatch like a pathway for our students. In the past, you all approved an outside contractor. I was trying to find the quote. It was like $2,700 that we pay this particular contractor every semester. So you're talking about over $5,000 a year to pay an outside contractor to train our students or to help our students get that 911 dispatch certification. On top of that, the contractor did not, we also had to pay for our kids to receive the or take the test for certification. But if we go with Priority Dispatch 911, that company's gonna teach Mr. Conover. He was already certified and licensed to teach the 911 dispatch class. So he's kind of renewing his certification. So the price that we're paying for that dispatcher, we'll have somebody on staff, we'll save lots of money that way. And we don't have to wait till the last minute to provide our students with that class. We can offer it, actually, I think it's like a 8-week course. So we can probably offer it up to 2 times a semester. Don't quote me on that. I wish Ms. Marion Lee was here so she could provide more information. But it's a cost savings to us. This is a 911 class. It's the 911 dispatch I class. think we had something like that before.
Mm-hmm.
Did Mrs. Tammy Poe have some
Yes,
kids
ma'am.
in
It's- yep,
in the
that's what-
911 program?
That's what it's for.
Oh, yeah.
Most of
that's
the
it?
special
Oh,
ed
oh,
kids.
yeah, okay.
Mm-hmm.
How many students do you think, how many students actually got their certificate?
I want to say at the end of last spring, maybe 12. Mm-hmm. And I think most of them was the special ed kids. And they needed that for the graduation pathway to come fill one of the buckets, I think bucket number 2. Yep.
All right, the next item?
Money line quote.
Okay. So your money line,
was introduced to us at one of the conferences, one of the Title I conferences. And what this company does, they don't sell you anything like those annuity programs and some of the other financial institutions that we work with. They don't try to sell you a service. What they do is they provide a service to our staff. Many of our staff don't make a lot of money. And for those people who make a lot of money, they can afford a financial advisor. Your money line will come in and work with our staff, especially our staff who have student loans. I don't know if many of you all tried to navigate the waters of loan forgiveness, but it is treacherous. So your money line is going to work with our staff in the loan forgiveness program, as well as some coaching on financial stability, we already know educators, teachers don't make a lot of money, how to help them budget their money for free. So it's like a financial coach. We have partnerships with universities where our EPs, we're paying for them to go back to be fully certified, but they also have to do the financial aid application first. So some of them have loans. So making sure that we can help them navigate those waters on either paying back those loans or going through the loan forgiveness program.
Thank you. Any questions?
Is there a cost associated with this?
I think it's like $1,200, $12,000. Mm-hmm. Yes. Is it 300 or 400 staff? Mm-hmm. And we have like 200 and some teachers, so.
The next is the top 20 amendment, Dr. Yanders.
Okay, so the top 20 amendment, you all approved the original MOU. The original MOU with top 20 was for their weekend program that they hold at our schools. So they have a weekend program, but the students or the kids who are involved in the weekend program is strictly a dance program, and anybody can come to those programs. You do not have to be a School City of East Chicago student. You could be any child in the city of East Chicago and go to school in Valparaiso. But with the amendment, with the addendum for top 20, this is going to be strictly for our students after school, and they're putting in a mentoring piece. Our students have so much trauma, and this is a way to bring them in. Not only will they be doing something fun, but they will also be receiving that mentoring support that is needed. So the top 20 addendum is a way to pay them to do that for the after-school portion with the mentoring program, and it's just for School City of East Chicago students, no one else.
And the SEL PD, alternatives training.
Once again, kids are coming with a lot of trauma, and we've seen that a lot this year. This has been a very unusual year for us. So I'm just trying to grab anybody that's gonna come in and help our students. But think about alternatives trauma care is not only are they gonna train our staff on recognizing trauma, students that have the trauma, how to care for them, how to respond to their needs, but they also have a component on how to respond to our own needs as adults, because some of us have trauma too. So they'll also be given training on how do we take care of ourselves. It's just, I've mentioned this before, it's like being in an airplane that's going down. How do you give yourself, you gotta give yourself the oxygen mask first before you give it to a child or someone in the seat next to you. So they're gonna come in and give us some tools for that.
Is there a date yet or no?
So the first date is November 5th. So that's our parent-teacher conference day. And contractually, the teachers start at 11 o'clock on that day. So they work from 11 to 6 on November 5th. So we're gonna pay, just like if we were to pay for after-school PD, this is the for-school PD. For the social workers, the deans, the counselors, and those are the only ones. Because for the nurses and the parents, that's their regular day, so we don't have to pay
So
them.
before 11, right? So
Mhm.
8 to 11?
Mhm.
Okay.
Yes, sir.
All right.
believe that is all for Dr. Yanders.
All right, well, thank you.
Thank you.
We appreciate your time this evening.
Thank you.
Was that, I think that was it, right?
That was it. So we've covered, and so I just still want to go over for the purpose of our trustees. There are 4 items which Ms. Simmons, as CFO, is responsible for. We will have an approval of the disposal for special education equipment and technology. There is an approval to accept the dual language grant. There is an approval to pilot a gun safety program. Last month, we approved the Let's Talk program, which is sponsored by the County Prosecutor's Office. That was for high school students. The gun safety program is specifically for our elementary schools. It is a pilot. It will only be one classroom that will be piloting it at Harrison School. And then the hopes of, they'll evaluate the pilot, and then they'll be able to expand it to all elementary programs. The approval of the Center for Workforce Innovation. Obviously, this was part of our work session. CWI presented to us, the approval will be their MOU to continue working to move forward with the redevelopment. And then we have for item 6.18 is an approval for an MOU. It is from Ivy Tech, and that is for students from Ivy Tech to do work study at McKinley.
So this,
Go ahead.
no, go ahead.
Work study as they're going to do their clinical hours,
Yeah, so
Yeah,
in
okay.
clinical hours, so for example, they are in
not student teaching, but
Not student
like
teaching.
student observation.
student observations.
Oh, I just wanted to ask, the next time that we have, you have all the, agenda, we'd like that, to follow what you got on that.
It's not in your packet?
What-
I don't think we
Where's
have a
it on
copy of the agenda.
Oh, you didn't have a copy of the agenda?
No,
Why?
I mean, I don't even know, I don't even know what.
Well, it's not, you don't have it on board?
No, what
It's
you're
not
talking
on
about.
board docs,
You know
no.
what I'm saying? I don't know what you're talking about. So
We will make
Just,
sure
just
we print
next
out
time,
the
next time, yeah,
copy
just
of the-
next time. We'll
absolutely.
just follow some rules around here and
And is that it for a work session?
That is it for the work session.
All right, okay.
I
So that
just
is,
wanted to ask Miss Leela a question, I just, because me and Mr. Holt, me and Mr. Joel, we gotta set a finance meeting, right, Joel?
Mm-hmm.
Oh, okay.
Did you want to do that in the?
We don't have to do it now, I just wanted to bring it up. But one
okay.
question that I wanted to ask was, I have this email here, and I never did receive it. I don't know if any of our board members ever received it, but when we were doing the superintendent search with BWP, I'm looking here, one of the individuals, they were asking for, did you ever get anything based on anybody asking for what amount of monies that we were supposed to be paying these individuals, or what they were wanting? Did you ever receive any information?
Are you referring to the superintendent
In the
search?
Yes, on
No,
anybody.
I have
You
not
never
received
anybody?
any email,
Because-
no.
Now, well, I'm just going, one of them was asking for $2,000 and $3,500. Now, did we have this kind of money to pay the individual if that's what they were asking for?
One of the individuals was asking for a salary of $235,000.
Yes.
I would have had to work my budget. That's,
You would have been
yeah,
able to
that
do
was
it?
not, that would not be a question that I can just give you
Okay.
right
But
off.
you never saw it though, right?
I did not receive,
Nothing on
no
nobody?
email on that.
Okay, that's what I want to know.
Was I copied on the email?
No, I don't know. I'm just asking this
Okay.
because a lot of stuff,
Yeah, yeah, I would have had to go over budgets.
Oh, okay. So,
For
okay,
anything.
you never got, okay, that's my question to you. Okay, thank you.
Mhm.
But with me and Mr. Joel to get with you when we do the finance meeting. Thank you.
all right, then that is the end for our work session. Thank you.